Welcome to our injection skill quiz. Let's put your knowledge to the test. In today's challenge, we're covering 4 essential areas of injections: intramuscular injections, subcutaneous injections, equipment and preparations, and finally, complications and patient safety. There are 3 questions per topic: 1 easy, 1 medium, and 1 hard, worth 1, 2, or 3 stars. After each question, we'll give you a moment to think, and then we'll reveal the correct answer, along with a quick explanation. Ready? Let's dive in. Which site is the most commonly used for adult intramuscular vaccinations?
Now let's look at the various IM administration sites. So as you can see here, we have choices. Deltoid in the arm is one. This is the most common injection site and relatively safe. So much of your vaccinations, you've probably even gotten one, is in the deltoid.
What is the preferred angle for administering an intramuscular injection?
Next, we need to remove the needle sheath and then position the syringe at a 90-degree angle. Okay, so positioning is important here for a lot of different reasons. When you go to give an intramuscular injection, you want to be head on. So I'm not very tall, so this usually isn't a problem for me, but if I'm really tall and I need to inject a patient with their arm here, you can imagine me going at a 90, it's going to look more like this. So please make sure you position the patient, you position yourself to get straight on and go at a 90-degree angle for your patient. With IM injections, 90 degrees is the preferred method.
A nurse is administering an intramuscular injection of iron. Which technique helps prevent medication leakage into subcutaneous tissue?
One of those is called a Z-track method. Now, it really is best practice to use this method. The reason why we use this method is to help prevent any leakage of meds into the subcutaneous tissue. The theory is that you're going to get all of the medication into the muscle, and you're commonly going to use it for meds that may stain the skin, for example, such as an iron intramuscular injection.
Which medication is commonly administered subcutaneously?
Now let's take a look at the equipment we're going to need. You, of course, are going to need your medication. This is commonly going to be in the form of maybe heparin, for example, that's a blood thinner, or insulin for a patient that's diabetic. That's really common subcutaneous administered medications.
After administering a subcutaneous blood thinner, what should the nurse avoid?
Let's not massage the medication into the subcutaneous later. This is particularly important with any sort of blood thinner given for DVT or blood clot prevention. This is a common medication you're going to give in clinicals. Give me an example of this is when I give a subcutaneous injection of a blood thinner in the abdomen.
Why should a blood thinner not be administered subcutaneously in the back of the arm for a bedridden patient?
One key note about administration of a subcutaneous medicine, that's a blood thinner. So if we can avoid it, we really don't want to give a blood thinner in the back of the patient's arm, because if they're in bed, they may rub here and this may cause bleeding or bruising at this site.
What gauge range is typically used for intramuscular injections?
Now, with an intramuscular injection, needle size is important. So this is going to range anywhere from a 22 to a 25 gauge needle. So when we talk about gauge, this is talking about diameter of the needle itself. Now remember, with injections, the higher the number, the smaller the diameter of the needle.
Which gauge range is commonly used for subcutaneous injections?
And of course, we're going to need our needle for injection. Now, this is going to vary depending on the device you use. The gauge, meaning the diameter of the needle, is going to range anywhere from about like 28 to about 31 gauge. So I know this is quite of a range, but again, it just depends if it's insulin you're giving or what kind of medication you're going to be administering. Take a look at the length here. This one's pretty short. 1/2 inch is pretty long, but 5/8 is also very common in needle length. We're only going into the adipose tissue, the subcutaneous tissue, so the needle can be much shorter.
Why should a blunt fill or filter needle not be used to inject medication into the patient?
Now, since we've punctured the rubber stopper, if you will, and pulled up medication, we don't want to use that same thing in injecting in a patient arm. So really important, detach this filter or blunt tip needle and apply a new appropriate size injection needle to the syringe.
Why should subcutaneous injection sites be rotated in diabetic patients?
If I have a newly diabetic patient or even a patient that's been diabetic, it's important for us as nursing to teach them that they need to rotate injection sites every time they take an injection. Reason being, if we keep poking the same spot and delivering medication there, malabsorption in that area will occur. The patient will not get the full absorption of all their meds. Therefore, we want to teach them, make sure you rotate sites.
A patient becomes pale and reports dizziness immediately after receiving an intramuscular injection. What is the nurse's priority action?
Anytime you have a patient up and you're going to give an injection, some people may get a little woozy, so if you think that person is it, then you may want to lay them back in the bed.
A nurse injects medication and immediately withdraws the needle quickly. Why is this incorrect practice?
With the intramuscular injection, there's several considerations we can look at. So first of all, what do we don't do? Now, after we give that injection, I know that it's a good accomplishment, we get that thing in, but once we inject the medicine, don't withdraw it too quickly. Give the medication a time to make sure that we've got that in the muscle.
That's it for today's quiz. Count your stars and let us know how you did in the comments. Keep mastering those core nursing skills with Lecturio, and we'll see you next time.